All right, we're here with episode 6 of Business and Technology in Tennessee with InfoSystems. I'm Josh Davis. I'm the marketing director at InfoSystems, and I've got a special guest with me today, Sam Johnson, CEO of VisuWell. And Sam, how are you?
Great. Thanks for having me in today. I appreciate it.
Yeah, you're welcome. So just to get started, let's talk a little bit about your company and maybe just some of the story. I know in Chattanooga, we've kind of over the years, as We Council got started, heard through the various startup organizations and startup initiatives and competitions and all of the news around tech startups in Chattanooga. We got to hear some about it, but I understand there's been change and you're somewhat new to the company, so I'd like to kind of talk about the background, the backstory, and then how you came to be involved.
Well, thanks. Yes, there's been a lot of change at We Council. First of all, Chattanooga is a fun little startup town. Mm-hmm. I've grown to really admire its intentionality around getting fresh, new technology startups off the ground, and that's definitely admirable, and big kudos to the town of Chattanooga for that. But We Council was, as you might have gathered over the years, focused on behavioral health, mm-hmm. and virtualizing that and improving the access to mental health providers and making that more accessible through the internet and through technology. Last year, the leadership of the We Council company, the board, decided to lend a little bit of support to that, and so they recruited me to come along and to talk about growth and what was next for We Council. And then what came next was a broadening of the net for the company out into expand from just behavioral to general health care. So there's now a new brand called VisuWell at play. We Council will still exist as a community of behavioralists underneath that VisuWell umbrella that focuses on mental health, some access to care in that space and behavioral space, but yet we're going to make the technology available to many different initiatives across the spectrum, including primary care, specialty referrals, telestroke. There's literally dozens of initiatives that healthcare are going after to improve access for right now. We wanted to play in the entirety of that space and not just behavioral.
Yeah, I think a lot of times it happens that companies that get started have a very focused goal and intention, mm-hmm. and over whatever period of time after getting started up, they realize that all of the platforms and processes and everything that they've put in place to deliver their business is a great mechanism to deliver other types of business.
That's right. There were very few changes necessary to the tech to make it ready for general health care and some of the other variety of initiatives that are growing just as rapidly as the behavioral space. Yep.
So would you still call like the access to healthcare over the internet? Is the term for that still telehealth or telemedicine?
Virtual care, virtual health, telemedicine. There's a lot of interchangeable terms for that. Telemedicine still seems to be the leading term, but I have been using the term virtual care a lot lately because I think it really says what the healthcare consumer, the patient, really understands the most. Yeah. The term tele may be a bit dated, where virtual seems to be more appropriate.
Yeah. Yeah, I guess digital, virtual, things like that are a little more current than tele. But over the years, I remember hearing points in time in news media and stuff where they would start talking about the future of telemedicine and things like that, and it never really seemed in a practical sense to take off anywhere, but apparently now there's a much greater opportunity, much greater technology and mechanisms to make it possible. Where is VisuWell and We Council now in terms of delivering services?
We're ready. There have been some pioneers and some groundbreakers. You will have heard the term Teladoc or American Well or some of the more direct-to-consumer by way of their insurance plan or their employer or their school system. So they've taken that angle. The approach that VisuWell is taking is to compete with or enable the local care provider that already owns the relationship with the patient to participate in that same type of experience for the patient. Today, let's be honest, the big consumer-focused organizations like I just named are absorbing visits from the local care providers.
Mm-hmm.
They are competing for that attention. And I just read yesterday a statistic that about 7% of patients are now willing to change providers to a healthcare provider that has virtual visit capacity or capabilities. That's a now significant number, where in the past 5 years that might have been more slight or more diminished. You know, as you approach 10% of patients that are willing to consider changing doctors to one that has a virtual component or a virtual deliverable is now a significant number.
Yeah, I know, just speaking from my own personal family experience, you know, we have small children at home, and for my wife to go to a doctor's appointment with children in tow is not always the easiest experience.
That is a challenge. I raised with my wife 4 kids as well, and that was always fun to take 3 healthy kids to a doctor's appointment with 1 sick one, and try to make sense of why we were doing that.
Yeah, or just go to a visit for yourself with your kids along and trying to divert your attention between the doctor and keeping the kids under control. It's just not easy.
Yeah.
So I can definitely see where the virtual opportunity would be great for scenarios like that, and I'm sure lots of other scenarios.
That's right. You look at the consumer trend in other industries, and it's very clear to see that efficiency and that consumer availability will continue to grow.
Yeah. So in working with local offices, healthcare providers, what is it that they're really signing up for? Are they using your technology as a platform to deliver the same types of services they would at their office?
Correct. We want to offer a platform that allows them to modernize their bricks and mortar deliverables and extend that care longer distances, longer hours, more flexible visit types. So we want to be the platform that allows them to, in a turnkey fashion, modernize their practice to these new way of seeing patients.
Yeah, that's
under their brand.
Right.
So we're not going to be VisuWell to them or their providers or their patients once it's deployed. So in a couple of weeks, you could deploy a platform that allows for, in your brand, whether it's family medical associates or OBGYN specialists or primary surgical specialist, whoever the name of the brand and the logo and color scheme is, that it can be deployed as if it were them without them having to go to all the expense of the cost of developing a platform like that.
And this is just me asking questions out of curiosity, but are there additional resources that they get access to through that program? Like, I mean, I'm just thinking from like a software as a service or a technologies firm where you would usually have, like a wiki type, a self-help informational resource that your customers can log into and use in times where they may not need face-to-face or personal care. Are there other items like that your local practices would have access to?
Such as care topics or content around care?
Yeah, content, exactly.
We will make available any content that the care provider would like to see available on that platform. We're not the writers of that content, but there's a variety, like Crames and some of these online content vendors we can easily make available via the platform. But some of the resources that we do make available are the education on telemedicine use. When is this appropriate? When is it available? What types of uses are appropriate for telemedicine? So general education of both the consumer, the patient, and the providers that are attempting to work it into their daily schedule. That's not just something that you know coming out of the gate. You have to be taught that, shown that, and discussed that.
Yeah.
So we do provide those types of resources, as well as virtual and real-time technical support to make sure that the first time you use it, there's no guesswork around how do I use the microphone, how do I use the camera, how do I log into the session. So that real-time staffed support for those types of questions is available as well.
So I would assume, it sounds like from that comment that you're providing some hardware type infrastructure that they would use to communicate with patients. Are they doing it on their own laptops and equipment they own today? Do they have to implement new technologies? How does that part of it work?
No hardware. It's strictly browser deployed, but as you know, there's differences between browsers, there's differences between operating systems on laptops. And so just giving them a little bit of guidance about, hey, if I've got a headset plugged in, where's the setting to make sure my microphone is coming through the headset versus my onboard microphone on the laptop. Just simple things that general consumers may already know, but if they're inexperienced with those types of things, or they haven't encountered using a headset before, maybe that's something that we could help them get through. But so, there's no hardware, there's no software. It's all online. It's all web-based.
Just a browser-based.
Browser deployed, no plugins, ready to go.
So we're getting closer here to the discussion topic of technology and healthcare, instead of just healthcare. And so, that's interesting to me. Obviously, I work for an IT company where we see technology every day, all the way from laptops and end user devices up to corporate data centers and cloud facilities, data center facilities where we have infrastructure and we deliver services for our customers. Talk about some of the IT challenges maybe that exist in building out this type of platform and delivering it to a local practice. Was it a long process? Was it a pretty quick and easy process? How many people, engineers and stuff like that had to be engaged? What's the back end like? And not that you're going to release any proprietary information here, but it's just an interesting topic to talk about the IT side of healthcare tech.
Sure. Yeah. The scope of the project has been a 6-year project, with an average of about 12 to 14 developers full-time on the project. So it's been an expensive project to make sure it's fast, accessible, HIPAA secure and private, and available via the widest variety of browsers and technologies available so that anybody can use it. So a lot of that has been feature sets that have been requested by us from a customer base, but a lot of it has just been very intentional development around, does the technology work in today's technology spectrum? I mean, that'll continue to be a project as we go along.
Yeah.
But that's a moving target, and we have to keep up.
Sure. And do you all deliver through your own data center, or do you host on with a partner? How does the back end infrastructure?
It's a partner cloud. It's a partner cloud delivered through our managed servers on that partner's cloud.
Gotcha.
Yeah.
Which is a great model. I mean, obviously InfoSystems is a cloud services provider, and we're obviously a proponent of that model because from our perspective, we know that if you have the right people with the right expertise in control of the right stuff, then it's much more likely to work the right way.
That's right. And we depend very heavily on making sure that's available. Our uptime guarantees to our customers depend on that partner. And a lot of things that just have to work correctly every day are taken care of by the right partner in that world.
Okay, so I'm gonna make a comment here that I'll give you an out. You don't have to answer if you don't want to offend any local healthcare providers. But in my observation over the years, visiting local doctors' offices and various healthcare facilities, it seems like a lot of them are really behind the times on technology. Like, if I go to a doctor's office and I sit down in a patient room and I look at the monitor, and it's still not a widescreen monitor. It's kind of the old resolution monitor, and I see them booted up, and it's booting up like Windows XP or something like that. And I'm just like, thinking about the amount of money, in the healthcare industry, I just sit there and think, why are they not more up to date on, the patient-facing technology, or the technology that the doctors have their hands on? Has that been a challenge with VisuWell working with local practices? And you're potentially dealing with people who don't have the latest technology deployed in their facilities.
Well, fortunately, it's not expensive to get caught up. In our world, it's just a newer laptop, $1,200 potentially for the nicest laptop, and a solid internet connection, and you've just leapfrogged over all that time that went by where you may or may not have paid attention to keeping up. So as is in all technology spectrums, the cost of that has continually gone down. So I would say if you missed the last 15 years and you didn't invest in technology, you're probably a bit better off than those that kept up along the way, to be honest.
Yeah.
So kudos to you for maybe skipping some of that expense.
Yeah.
Because right now, to catch up, it's basically a laptop and a good solid internet connection, and then boom, you're in the telemedicine business.
Yeah, and I understand a lot of times when businesses, and it's not just healthcare, it's manufacturing and a lot of different types of businesses, when they run older systems, it's probably because they have invested a lot into the technology that runs on that platform, and it's not always so easy just to flip a switch and make things upgrade.
Sometimes those barriers are determined by the vendor that you selected back then, and their ability to keep up with and to build in technological advancements for you along the way. So
yeah,
there's a lot of that handcuffed experience that's gone on in the past.
So I'm kind of curious, like, I don't know if you're a futurist of the healthcare and technology industry, but I wonder if there is a point in the future where maybe you have a completely different model of healthcare delivery, in that, we talked about the brick and mortar facilities. There's always going to have to be a brick and mortar facility for people to go to for procedures. But for a lot of the other counseling and check-ins and things like that, do you think there's going to be a move into more of like a freelance, independent, maybe from a home office healthcare model where people don't have to have?
There was a program that just got instituted at New York Presbyterian. They have a residency training program, and I noticed the other day that they announced a clinical virtualist as a medical specialty. First time I've ever seen those terms used in the context of a residency program, but they are expecting, and they're one of the world's leading hospital thought leaders. They have now created a new specialty called clinical virtualist, and that's a lot of the reason for the terminology that I now use for virtual medicine, because I think that specialty will not only stick, but it'll grow. Yeah,
makes sense. So what's the coolest thing you've experienced working with VisuWell? I mean, I know you're probably passionate and excited about the future of the company. Where are you at with that, and what's the coolest thing you've experienced in your time?
What drives me is making a difference in individual people's lives. And there's two categories of people that we affect. We affect the provider's life, and we affect the patient's life. We're just there to facilitate, find ways to make those two categories of individuals' lives better. One of the biggest things we bring to the provider community is the ability to do more with what they've got. We've got providers that are going to psychology programs at hospitals, and they're driving 3 hours to this campus and 2 hours to this campus and 1 hour to this campus, getting that drive time back in their day and modernizing that program for a group session or for an individual therapy here or for a follow-up there, and not having to spend that time in the car when they could be spending that with patients makes their lives better. Patients, as you mentioned, the four kids at home, 3 kids at home, 2 of them are healthy. 1 of them is needing to see a doctor for that 3rd ear infection this quarter. That's the type of visit that we could not have to travel to or interject all this disruption in our lives just to go take care of that. So that kind of difference that we're making in individuals' lives really gets us jazzed, and me personally, that's what I really thrive on, is making a difference in individual people.
Yeah, and I know just from checking out your LinkedIn profile, you have personally a very extensive history in the healthcare industry. So, what would you say, from taking out all of the experiences across your career thus far, what led you to VisuWell, and what's next for VisuWell? Where are we going to see VisuWell in a couple of years?
Well, fortunately, I've been timely for a lot of trends in healthcare. I was early to the EMR. Back then it was the CPR. Now it's the CMR, says Judy Faulkner with Epic, the comprehensive medical record. So, but I was early in whatever you want to call that world when doctors were predominantly paper. And I started my career in credentialing and privileging, but moved quickly into the electronic medical record, electronic health record, comprehensive health record, whatever you want to call it. But I got to see that conversion from paper processes and paper documentation now to the comprehensive medical record concept. And so that was incredibly fun. It was industry changing. It was a massive move. I then entered into the healthcare messaging world, which was sort of early and new with appointment reminders and some of those basic communication points. Now we have chatbots, and we have loops with mobile technologies that really seek to pre-diagnose or predispose of patients prior to them engaging with a provider. So that was a big, massive move. And now I think we're in that 2018, 2019 adoption range of virtual care and telemedicine. So the timeliness of my progression, or I guess you'd say journey through healthcare, has hit some pretty major milestones of transition. And I guess I'm just a magnet for it. I enjoy the change.
Yeah, some people
like
run from it.
Next.
Some people are drawn to it, so it seems like you're the kind that's drawn to the big epic changes.
The shiny new objects, that's right.
So the largest audience for our podcast is kind of the regional small and mid-sized business leader.
Great.
So taking that audience into mind, what do they need to know about VisuWell and about healthcare technology?
General business owner?
Yeah, how does this technology impact, a local business owner, not in the healthcare industry, but they may employees, and this may impact their HR departments and lots of other things, I would imagine.
Right. All of those businesses employ healthcare consumers. They all have, whether it be 2 employees or 200 employees, they employ healthcare consumers. And to begin to ask their local provider, how do I participate in this? How is your plans for the next few years helping us be more effective at work? How do the productivity levels, how are they contributed to by what you're providing to our employees? And so helping your employees select providers, or encouraging them to select providers that do participate in more timely, efficient mechanisms of healthcare directly affect the bottom line of the business owner, I think, because it speaks to time off work, it speaks to productivity, getting people healthier faster, not waiting 3 weeks to deal with an issue when it could be dealt with now. So a lot of productivity around the employee is at play here if we do this right, and if providers take the step to think about, hey, how am I going to roll this out? How am I going to get to where I need to go with telehealth as a service to my consumer, my patient? Patients prefer that. They don't want to get online and see some random doctor that whoever comes up on the screen in a virtual waiting room. They prefer if their doctor that they've trusted over the years, they've formed a relationship with, would just go ahead and take the step, now that it's technically possible, for them to offer that kind of care in addition to the normal bricks and mortar visits, the normal on-site visits.
Yeah, I would imagine that the quality of care has to be way higher for, if your provider, your virtual provider is your normal provider who knows your history and has a long track record of experience with
Well,
you.
they're being asked to communicate with patients more often. They're being asked to manage disease more proactively.
Mm-hmm.
The only real way to do that, because we're maxed out in our facilities, the waiting rooms, is to extend that out into the homes and out into the long-term care facilities. So that higher rate of touch, or that higher frequency of communication, really the only way to achieve that is through virtual care.
Yeah, and I guess you kind of get to one of the criticisms of the healthcare industry, and that's that it's typically been reactive. People go seek out care when they're sick,
That's right.
instead of having a healthcare provider who's actively engaged in keeping them healthy.
There's nobody more equipped to managing that care plan than the provider that knows them the best.
Yeah.
That's right.
Well, that's great. Any last minute comments today for the audience about VisuWell, things we should know?
I just appreciate the opportunity to discuss these topics. It's obviously very fun and exciting for us to be venturing down this path, and we appreciate you checking us out at visuwell.io.
Yeah, great. Thank you very much, Sam.
Thank you.